Hi guys, my name is Tammy and I'm a doctor of physical therapy. In this video, I'm going to talk about neck pain that is associated with mobility deficits. If you haven't watched a previous video about the 4 PT diagnoses for neck pain, I highly recommend that you do so, as it gives you a better understanding of what we're doing in this video. Now, before you do any of these exercises, please read the indications and the contraindications, as well as the red flags listed below in the description. The most common signs and symptoms of this condition are, again, neck pain that is either on one side or both sides. You will have some sort of lack of range of motion in your neck. So let's say you can't turn all the way to one side, and when you get to that side that you're stuck on, it reproduces your symptoms, it reproduces your pain. And you might also feel pain in the back of the shoulder blade traveling down your arm. Most common causes of this condition is some sort of a muscle sprain. This can be due to overuse, which is having poor posture, like sitting at your desk all day long like this, or texting like this. It could also be because you slept wrong on it, or if you jerk your neck while doing an exercise at the gym. There are other medical diagnoses that are related to this condition. I will list them down in the description for you, but some of the common ones are osteoarthritis of the neck or degenerative disc disease of the cervical spine. But regardless of why we got this pain, our focus is to try to improve those functional limitations. So we are going to focus on exercises that are going to strengthen the weak muscles, stretch the tight muscles, and improve the range of motion in the joints. So I'm going to break up this video into 2 parts. The first part, we're going to focus on techniques we can use to try to ease the muscles, to get rid of that tightness you're feeling in the muscle using our fingers and some other tools. The second part of the video, we are going to focus on exercises that we're going to do to help improve the condition. We have 7 cervical spines in our neck. Let's figure out where the problem is coming from. If you're unable to move your neck at all, if you can't rotate it at all, and you have to move your body in order to look back, most likely the cause and the origin of our issue is in the upper cervical spine. If you can move your neck a little bit, let's say about 45 degrees, and then you feel stuck and you have to move your body to turn, most likely the pain is coming from the lower part of your neck. Now, let's say the pain is coming from the top part of our neck, the upper cervical spines. So what I want you to do is you're going to take both hands, you're going to put it right on top, the top part of your neck, okay, where the bony structures are. And you'll feel those muscles. And I want you to, just with your fingers, you're going to palpate. Find the middle of your spine. You have some bumps on them. Those are the spinous processes of your spine. You're going to kind of feel for them, and then put your fingers in the middle and then gently move to the side. So you put your fingers right in the middle, and then you're going to go to either side, and this should feel really, really good. And you might feel some point tenderness. You might go over a structure or a bump or a muscle that might be really painful, and that could be the cause of your pain. So what I want you to do is, once you feel those spots, just try to massage it, roll it, or with your thumbs hold those areas where you feel most of your pain. Now try to do it one side at a time, because it can be pretty painful. Now, if this feels like a trigger point to you, so when you press on that one part, it starts shooting pain everywhere, you have 2 options. A is you hold your thumb right on that painful spot, and you hold it until your pain subsides. Okay, usually this might take about 30 seconds to a minute. And once your pain subsides, let go. The second option is that you hold on to that painful spot and then try to move your neck. So you can either rotate to the opposite side, you can rotate to the same side, but you are maintaining that pressure the whole time. So I'm just going to rotate, or you can look down or look up. And this feels really, really good. Now I'm going to show you guys the same thing in reverse view. So again, you're going to feel for the bone, go right underneath, put your hands on both sides, and try to go outwards. And with your thumbs, you're going to palpate for those areas where you have a lot of pain, You're either gonna hold or you're gonna rotate to one side, rotate to the other side, look down, and look up while maintaining the pressure on your thumb. Now, if the pain is coming from our lower part of the spine, same thing. With your hands, you can go on the lower part of the spine, try to really find those pressure spots. Either you're gonna do a rotational movement to try to release them. If you get to a really tender spot, again, you're gonna hold it right there with your hand. You can first rotate to the side. You can rotate down, so I'm bringing my nose towards my side pocket as I maintain that pressure. And remember, you guys, if you are doing this movement where you're holding and you're tilting your neck, you might feel an intense shooting pain. It's okay, we're trying to release those tight muscles. Now, I will later on create a video where I will go over ways you can get rid of a trigger point, but I'm just giving you an overview right now, okay? Now, the other thing we can use is a peanut ball or a lacrosse ball. You just need to be near a wall. Again, what you're gonna do is you're gonna take the ball, put the ball right on that sore spot, and lean against the wall. So, for me, I feel it right here. I'm gonna hold it right there, then I'm gonna move my neck to the side, then I'm gonna move it out, and this feels really good. Once that point is not painful anymore, I'm gonna move the ball to another painful spot, hold it right there, and again, move my neck, or you can move your arm. See which one feels better, okay? And if you want, you can even go lower into your upper back. Remember, all these muscles are connected. Try to explore with this. See where you feel most of your pain and try to release it. If you don't want to move your arm or your neck as you're doing these exercises, it's okay. Just put the ball where you feel it and hold it right there until the pain subsides. I know it feels like it won't, but trust me, eventually the pain will subside. The third trick I'm going to teach you is, again, this works best if it's for the lower part of the neck, and it's going to help with our rotation movement, okay? You're going to take your hand, you're going to put it right on the back of the neck, okay? Feel for those bony parts of your neck. Again, that's your spinous process. You're going to put your hand right on the outside. So if the spine is right in the middle, you're going to put it right on the outside, and as you rotate towards one side, you're going to bring your hands to the opposite side. So you're trying to move the spine. Okay, so again, you put your hand right on those spots. As you rotate your neck with your hand, you're going to go to the opposite side. So I'm pulling my hand on the tissue and I'm rotating it, and this feels fantastic. And I'm going to show you this in the reverse view. So again, I'm going to feel with my finger, go right over those bony prominences, hold on with my hand to the outside. So if this is the spine, I'm going to the outside, right on the lateral side of the spine. As I rotate, I'm pulling my hand to the opposite side, and I can go up or go down on the neck. Now, when you're using these techniques, you have to be very mindful of your sensitivity. If this is the beginning of your injury, you might not be able to do a lot of these things because your tissue might be super sensitive. Also, when you do these manual techniques, you might increase your pain for a little bit. If your pain is not subsiding, I highly recommend that you still see a therapist, because they will be able to do this for you much better than you can for yourself at home. Now, for the second part of the video, we're going to focus on the exercises you're going to be doing to help improve your condition. Remember that doesn't matter how often you're getting the passive treatments or you're self-treating yourself with your hands, your results will not be successful if you're not participating in the active part of the therapy. I have broken up the exercises into 3 categories depending on where you are in your injury. So if you are in the first category, which is from day 1 to week 6, you are in your acute stage of injury, and the tissue is still very sensitive, so we have to start with super gentle exercises. The first set of exercises we're gonna do are neck range of motion exercises. There's just a couple of things I want you to make sure you do while doing these exercises. Number one is pay attention to your posture. So make sure you're not slouching, you're sitting up tall. You can be sitting on the floor or a chair, wherever you're comfortable. And the second thing is it has to be no pain involved. So you're only gonna move your neck to where you feel your pain. Don't push it beyond that point at this stage, okay? You're gonna do each of these exercises 10 times and hold for 5 seconds each time. The first exercise is neck flexion. So you're gonna bring your chin down towards your chest. You're gonna go all the way down, hold before you start having any pain, and come back up. So I'm gonna repeat that one more time. You're gonna bring your chin all the way down towards your chest, and all the way back up. The second exercise is neck rotation. So I'm gonna start on this side first, then I'll show you on the other side. So you're gonna try to bring your chin towards your shoulder. So again, slowly, gently, rotate all the way. Again, pain-free range of motion. Hold it for 5 seconds. Bring it back to center. I'm gonna show you one more time. So I'm rotating all the way and coming back to center. Once you're done your 10 on this side, let's repeat on the other side. So again, you're gonna bring your chin now towards the opposite shoulder and back to center. Make sure that your shoulders are relaxed, okay? Don't try to tense up. The next exercise is side bending or lateral flexion. So what I want you to do now is pay attention. You're gonna bring your ear towards your shoulder. So again, we're gonna go down, hold for 5 seconds, slowly come back up. Now, if you have pain on this side, when you go this way, you might feel a stretch. The stretch is okay. I just don't want any sharp shooting pain. Gonna hold for 5 seconds, come back to center. Again, I'm gonna show you one more time. Come back to center, and then let's repeat on the other side. So we're gonna go to the other side, come back to center, one more time. Great, guys. Now the last one, which might be a little bit sensitive for you guys, so if it is painful, you don't need to do it, but it's neck extension. So again, we're gonna make sure we're sitting up tall. All you're gonna do for me is bring this neck back and forward. You don't need to go all the way back, guys. If you're feeling pain, stop right before the pain. If you want to use your hands to help you, you can. Put your hands right in the back of your head. Try to help your neck go back and come back forward. Again, one more time. And come back forward. The second set of exercises are neck stretches. Now remember, you're going to hold each stretch for 30 seconds and you're going to repeat it 3 times on each side. First stretch we're going to do is an upper trap stretch. That's the muscle that's located right over here. So what I want you to do is find a comfortable position again, either sitting on the floor or sitting on a chair. You're going to bring one hand and put it right next to you. Now what I want you to do is you're going to gently bring your ear towards your shoulder. So let's do it together, guys. Gently bring your ear down and bend your neck. Make sure you're not slouching, that defeats the purpose. Sit up tall, just tilt. Now we have a couple of options here. If you already feel a nice stretch here, hold it right there. If you want to make it harder, if you don't have any shoulder issues, bring your hand behind you. If you have shoulder issues, you can progress it by bringing your arm away from your body. So I'm going to bring my hand behind my back. You're going to take your other hand, you're going to put it right over your head, and you're going to gently apply a little bit of overpressure. So I'm pulling my head down this way, but I'm still sitting up tall. So this is not the stretch. You need to be sitting up tall. The second stretch is elevator scap stretch. That is the muscle sitting right on the back of the neck. So what I want you to do is take your hand, put it on the floor, or right behind you, depending on how your shoulder feels. You're gonna tilt your neck away from your body. Then you're gonna gently rotate your neck down so you're looking at your side pocket. You're gonna take your other hand, put it right over your head, and very gently, you're gonna apply overpressure towards your side pocket. So the first stretch, we're going sideways, and this one, we're pulling it down a little bit. So you should now be feeling a stretch. If you're not feeling it, it's probably because you're slouched. Sit up tall and gently apply that pressure. So this is a stretch that also helps you see if you need to take a shower. So you're almost like you're smelling your armpit. The third stretch we're gonna do is for the front of our neck. So what I want you to do is you're gonna put your hand on the floor. You're gonna tilt your neck away from your body. So I'm bringing my ear to my opposite shoulder. Then slowly, gently, you're gonna bring your neck back a little bit. I'm not losing that side flexion though as I'm bringing my neck back. Then what I want you to do is just slightly tilt towards the ceiling on the opposite side. So I'm not rotating all the way. It's just super subtle movements. I'm going to show you that one more time. Sit up tall, roll your shoulders back, put your hand away from your body. This is very important. Then you're going to tilt your neck away from your body, go back just a little bit, and rotate to the opposite side. So you should be feeling a really nice stretch in the front of the neck, maybe even your ear, going all the way down towards your arm. The last set of exercises we're gonna do in the acute stage of our recovery are isometric exercises. These are the ones that we use to help improve the strength in our muscles. Remember that they should all be done in a pain-free range of motion. So if any of them are causing any pain, you shouldn't be doing them yet. Also remember that you're gonna hold each position for 5 seconds. You're gonna repeat it 10 times on each side and make sure to have fun with them. The first exercise we're gonna do is isometric exercise for neck flexion. Okay, so that's this movement. What I want you to do is you're gonna put your hand right on top of your forehead and you're gonna gently push your neck forward, and with your hand you're gonna resist that movement. So technically I'm not really moving my neck, I'm just providing that forward pressure. Put your hand on your forehead and just gently push forward as you're pushing back with your hands, and we're gonna hold it for 5 seconds. So you're gonna go 1, 2, 3, 4, 5. Now you guys, imagine what your maximum force is. I want you to do about 50% of that force, again, with no pain involved. If it's causing pain, skip the exercise. The second isometric exercise is going to be for neck extension. So you're gonna take your hand, put it right behind your head, and you're gonna push backwards. So we're gonna go 1, 2, 3, 4, 5. Again, I'm not actually moving my neck, I'm just pushing into my hand. So go 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. I'm going to show you guys these exercises in the side view now. So again, we're going to start with neck flexion. Put your hand right on your forehead and just push forward. Now watch my posture. I'm not slouched, I'm sitting up tall. And let's do it. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. I'm going to do the extension, putting my hand behind my head, and I'm just going to push back. 2, 3, 4, 5, relax. 2, 3, 4, 5, relax. Now we're going to go over our third isometric exercise, which is rotation. You're going to put your hand right on your face. So I'm going right on my cheekbone, kind of avoiding that jawbone. You don't want to put too much pressure on the jaw. You're going to just gently, I guess some of my hand is also on my forehead. You're going to gently rotate to the side. 1, 2, 3, 4, 5. Again, you guys, I'm not really moving. I'm just pushing my head into my hand. 2, 3, 4, 5. Great. Let's do it on the other side. Again, I'm going to put my hand right on my face and I'm going to rotate my head into my hand. 2, 3, 4, 5. You can also make funny faces to make it a little more fun for yourself. And then we're going to do side bending, okay? So again, put your hand now right on top of your head and we're going to bend to the side. 1, 2, 3, 4, 5. Let's do one more time. 2, 3, 4, 5. And repeat on the other side. Put your hand right up and 2, 3, 4, 5. One more time. 2, 3, 4, 5. Now I'm going to go over 2 more isometric exercises. The first one is a chin tuck. Okay, so what I want you to do is we're going to try to create a double chin. Push your chin backwards. I'm not using my hand at all. just pushing my neck back. It's almost like you're gonna straighten out the back of your neck, and we're gonna hold it for 5 seconds. So let's do it together. 1, 2, 3, 4, 5. 1, 2, 3, 4, and 5. Great. Now I'm going to show you the same exercise in the side view. This is the chin tuck. So what I want you to do is you're going to try to push your chin backwards. We're not going down, we're not going up, we're just going back. So I'm having that double chin when I do this. 2, 3, 4, 5. You should be feeling a really nice stretch right in the back of the neck. And the last exercise I'm going to teach you is a scapular squeeze. So what you're doing is you're squeezing your shoulder blades together like you have a penny right in between those bones, and you're trying to hold on to it tight as I'm trying to pull that penny away. So let's do it together. Squeeze 2, or a $100 bill. Squeeze 2, 3, 4, 5. 1, 2, 3, 4, and 5. So I'm going to show you this from the back view now. Imagine you want to try to squeeze a penny right in between your shoulder blades. So I'm going to go 1, 2, 3, 4, 5. 1, 2, 3, 4, and 5. Now, if you are in the subacute stage of your recovery, which is approximately from week 6 to week 12, I want you to keep doing the same exercises we have been doing in the acute stage, but we are going to progress the strengthening aspect of our exercise program. Now, the focus for this part of our treatment is going to be improving the strength and the endurance of the muscles in our upper back. There are many exercises that can be very helpful for improving the strength in our upper back, and I will dedicate a video to upper back strengthening exercises later on, and we'll provide a link in the description for you guys. But here I'm going to go over my 3 favorite ones. The first exercise we're going to do here is a progression of our scapular squeezes. So what I want you to do is grab a band. I have a loop here. It doesn't have to be a loop, it can just be a TheraBand, or you can even use a belt. Again, I will provide a link of what I use here down in the description. But let's start. So what I want you to do is you're going to sit up tall, or you can be in a standing position. You're going to hold on to your band. You're going to bring your shoulder blades by your side, have your elbows right by your side, and let's go back into our scapular squeeze. Squeeze your scapula together, so you're squeezing your shoulder blades together. As with your hands, you're going to try to pull the band apart and bring it together. Okay, so squeeze, open up, and bring it together. Again, you guys, I don't want you feeling any pain with these exercises. Now you're going to do 3 sets of 10 repetitions of this exercise for me. The second exercise we're going to do in this section are going to be shoulder taps. So this is a great stability exercise for our shoulder and for upper back. What I want you to do is you're going to either go into a plank. I'm going to do it from my knees because I have more control. I want you to have your knees hip width apart, bring your body forward so you're in a semi-plank position, squeeze your shoulder blades back, and all you're going to do is tap one hand to the opposite shoulder and switch. So really engage your core here and make sure that your wrist is right underneath the shoulder blade. Okay? Squeeze your shoulder blades back in their sockets so you're not shrugging and you're not slouching, and all you're going to do is go ahead, tap. This is also going to really improve our core strength. Now, if you have knee issues or for whatever reason you can't do this exercise, it's okay, guys. You can skip it. Don't worry about it. I will create a video later on that will focus on other exercises you can do to improve the strength in your upper back. The last strengthening exercises I'm going to show you here is again going to involve using the band. So what I want you to do is again find a comfortable position, either sitting down, or you can be standing up or even lying down. And you're going to bring both arms forward, squeeze your shoulder blades back, sit up tall. You're going to create that tension in the band, so you're pulling it apart a little bit. You're going to slowly bring it into your chest and bring it away from your body. Again, bring it into your chest and away from your body. So you should be feeling that tension in your arms going all the way in your back. I'm going to show you guys this in the side view again. Bring your arms straight forward, squeeze your shoulder blades back in their socket, create that tension in the band, so bring the band apart, and you're going to go in, squeeze, and go out. In and slowly go out. Now, all the exercises I showed you in this section, I want you to try to do 3 sets of 10 repetitions of each. If you have more time, you can try to do that 2-3 times a day. If you are at this point going to the gym, it's okay if you want to start doing your lat pull down exercises, your row exercises. Again, as long as they're not increasing the pain in your neck or upper back, you're okay to do them. Now we're going to talk about the exercises we can do if we're in the chronic stage of our condition, which is if you've had this pain for more than 3 months. So at this stage, you can do all the exercises we did in the first 2 stages. But in this stage, we're gonna add some mobilization exercises that you can do at home. I'm only gonna go over 2 mobilization exercises we can use that can help improve our condition. Again, I will create another video later on where I will focus on other stuff we can do to help increase that range of motion in our joints, in our upper thoracic, which is your upper back and your neck area. But we're gonna start with super simple ones here. For the first exercise, I need you guys to grab a towel. And what we're gonna do is we're gonna put that towel right behind our neck, okay? So you can actually pick different parts of your neck, wherever you're more comfortable. I'm gonna start right in the middle. You're gonna bring one arm down. So I'm going right across my chest with the other arm. As you rotate, you're gonna pull to the side that you're rotating towards. So if I'm rotating to this side of the room, I'm gonna stabilize with one arm. With the other arm, I'm gonna help rotation of my neck, okay? And I'm kind of pulling my hand in an upward rotation movement, okay? So you're gonna rotate, come back to center. Good. Now if you want, you can go on another level of your neck where you know where you have more pain. We can go a little bit lower. Again, hold this side down, rotate. Okay, so basically this is helping you rotate a little bit more, and you can go at different levels again. Okay. Now, another movement we can do with a towel is to help our neck go into an extension movement. Again, make sure you're sitting in a comfortable position, that you're not slouching. You're gonna put the towel right behind you on whatever level you want on your neck. You're gonna bring your elbows close to your body. And what I want you to do is, as you go up, you're gonna bring the towel up as well. So I'm keeping my elbows together, and I'm helping my neck go more into an extension position. I'm going to show you guys the same movement in the other view. If I'm sitting here, I'm going to bring my arms together, and I'm going to go up. Again, and you can do this at different levels. Okay, so you move the bottom of the towel on different levels of your spine, and you kind of take your arms up as you take your neck back, and it feels really, really good. And right after you do these exercises, move your neck. See, am I moving it better? Wow, magic. The last thing I'm going to show you guys in this video is how to use a peanut ball. This is one of my favorite tools. I almost tell all of my clients to buy one. They're really not that expensive, especially if you buy them off Amazon. I usually buy them from Amazon. Again, I'll put a link down there for you guys. If you don't want to buy from Amazon, I'm pretty sure you can find them as Sports Check. They might just be more expensive. So what I want you to do with this, remember, it is going to be painful. And this is probably the only time I'm going to tell you guys, you know, this movement is painful. Again, it shouldn't be sharp shooting pain. It shouldn't be a kind of pain that's gonna last after you're done with the exercise. But while you're doing it, it is going to be painful. But if you do it every day, eventually, you know, it will do magic for you. Now, this is not a technique you can just use for your neck. You can also use this for your upper back. But again, I won't recommend using it if you've just injured yourself. This is for people who've had this issue for a long period of time. What I want you to do is, you see how there's like an indentation right here, right? You're gonna put that right where your spinous process of your thoracic spine is. Again, remember you guys, I told you, you can feel for that bony parts in your spine. That's called the spinous process. And the thoracic spine is just the part of the spine that belongs to the upper back, okay? You're gonna put that right there. Keep your feet on the floor, and you're gonna slowly lie down, okay? So the ball, each ball now is on either side of my spine. I'm gonna take my hands, put it right behind my neck, keep my elbows together. I'm gonna slowly go down. Now, I have done this before, and it is painful for me, but I have that range of motion to put my head all the way down. If you guys don't have that range of motion, put pillows, put 2-3 pillows under your head so you can try to kind of relax down here. Now we have a couple of options. Number one, you can just hold it here, okay? And this is just great in itself because it's gonna open up our chest, get rid of the tension in the front of our neck, but also it's pushing our upper back towards the ceiling. So from here, if you can, if it's not killing you, I'm going to challenge yourself. Bring your arms all the way up overhead, make a big circle, bring it back to center. Take your hands, remember you guys, don't ever lift up from here. Use your hands. Go ahead, grab the back of your neck, use your arms, come up. So I felt nothing in my neck right now because I'm holding on to it with my hands. Then you're gonna go to one side, tilt your body to one side, tilt your body to the other side. And you are gonna know that there's some parts that are gonna be more painful than the others, okay? Where you feel that pain, you feel that it's almost like a trigger point again, hold it right there. If you can. You're gonna come back to center. Then I'm gonna use my legs, bring my body down. I'm just gonna scooch down a little bit. So now the peanut ball has moved up one vertebrae, okay? Again, I'm gonna hold it there. Keep your elbows together, don't go here. Keep your elbows together, gently go back. And again, hold it there. Take a couple of breaths. Bring your arm up, over, and back to center. Again, pick up your head and go side to side. And try to release those tight muscles. And you're gonna, if you're ready to get up, use your hand, sit up, okay? Now again, you guys, it's gonna take time to learn how to work with this. Be patient with it, and you wanna try to go over every vertebrae. And eventually you might start hearing those popping sensations, and you know that's just tension being released. After you do this, if you get up, you're like, oh my God, like I'm sitting up taller. It feels great, and I highly recommend you do this at least 2-3 times a week. So those were the exercises I want you to do if you are in the chronic portion of your recovery. I also want to mention that at this stage it is amazing that you try to do some sort of aerobic exercises, incorporate yoga into your routine, and if you are someone who was already doing strengthening exercises, try to go back to your normal habits. One thing that I highly recommend to incorporate into your routine is breathing exercises. And again, I will create a video where I will go over how to do that, and I'll make sure to put a link in the description once those are ready. Now, I can't stress enough that if you are experiencing a lot of pain and a lot of limitation in your neck, I highly recommend that you see a therapist, seek help, because honestly, they can do stuff for you that you will not be able to do at home. If there are any specific things you want me to focus on, please make sure that you leave a comment in the comment section for me, and I'll make sure to elaborate on those subjects. As always, if you have any questions or concerns, please contact us. And if you like this video, don't forget to like, share, and subscribe.